There we go. I'd like to call the House Health Committee to order. With the clerk, please take our roll. Kumar. Okay. Lynn. Sign in. Okay. All right.
Mr. Chairman, we have 15 members present. You have a quorum.
All right. Thank you. And before we get started with our agenda, do any of the members have any personal orders? All right. Seeing none, we have 7 items on the agenda today. Go with item number 1, House Bill 1084. Representative Martin, you are recognized. You have a motion and a second.
House Bill 1084 would begin a limited grant program to reimburse LEAs, charter schools, and private schools and first responders to purchase anti-choking devices. The grant is limited to $500,000 from July 2025 to July 2028. Schools may purchase 1 device per cafeteria, and first responders, such as a fire and EMS, may purchase 1 per vehicle. The Department of Health would promulgate the rules pertaining to eligible devices for reimbursement and would administer the program. And with that, Mr. Chairman, I stand ready to answer any questions.
All right. Thank you. And I do think we have to attach an amendment to this amendment, drafting code 004446. Is that correct?
Yes, sir.
Getting a motion? You have a motion, a second. If there's no objections, go ahead and vote on the amendment. All those in favor say aye. Aye. Opposed? Ayes have it. Back on the bill is amended. Do we have any questions for the sponsor of the bill? Representative Mitchell, you are recognized.
Yeah, thank you, Mr. Chairman. This device, has it been approved or endorsed by the AMA?
You recognize.
These devices are registered with the FDA, and since this device is non-invasive, this device is registered, but it's not approved. We have these in several restaurants, the schools in Hamilton County. I think we have about 2,200 of them out through a private organization. And what we're trying to do is to provide the love across the state so that there could be the opportunity to save lives, as we've seen it happen in Chattanooga.
Representative Mitchell.
Yeah, so what is the liability of our schools for these devices? If someone, they use the device, a teacher or an administrator uses the device on a child and it does not work, what kind of liability does our LEAs have?
You recognize.
Yeah, I know that question was proposed in Hamilton County when we were putting these in our schools, and the school board attorney did not find a problem of where they would not be put into the schools. I know that I'm told that these have not had a failure rate, whereas people sometimes don't know how to do the Heimlich maneuver. Or sometimes you may take a small person trying to get their arms around a large person. They can't do that. But these are non-evasive. So this is like something that would help suck the food out of someone's throat when they're choking. And like I said, I know in the last couple of years, we've had 7 different individuals who have been saved because of it.
Yeah, thank you, Mr. Chair. Have you saw the Attorney General's opinion on that? Whether our LEAs are going to be liable or not?
You recognize.
I have talked with legal services, but no, I've not talked with the Attorney General about this particular bill, as there's several bills I've not talked with the Attorney General about.
Sounds problematic. Thank you, Mr. Chairman.
Thank you. Chairman Kumar.
Thank you, Mr. Chairman. I was just going to ask, is there recommended training required or recommended by the manufacturer, because that could allay the concerns and the liability because people have been at least properly trained to use this device.
You recognize?
Well, it would depend which exact device you got. The one that I'm familiar with has very simple instructions that come with the device.
Thank
This-
you.
Mhm.
Thank you.
If there is no objection, I'm going to go out of session here to ask legal services. So could you, for the record, your name?
Heather Oswald, Legal Services.
So I guess the question that I have would be if this was made available from a Good Samaritan standpoint, would that apply?
So TCA 63-6-218 is the Good Samaritan law. And in summary, it says any person shall not be liable to victims or persons receiving emergency care for any civil damages as a result of any act or omission by such person in rendering the emergency care. And it kind of lists who in good faith, and it says renders emergency care to see an accident, medical emergency, or disaster. And it includes, using automated external defibrillators or participates or assist in rendering emergency care. So if this was used in an emergency situation, I believe it would apply. The Good Samaritan law I believe it would apply.
All right, thank you. All right, we will go back into session. You're recognized. You're good.
I'm stand ready for questions and look forward to your approval.
All right.
Hopefully.
Seeing no further questions, we are ready to vote. Clerk, can you please open the vote? All those in favor of House Bill 1084 moving on to GovOps, vote aye. Those opposed, vote no. Has every member voted? Does any member wish to change their vote? Madam Clerk, can you please take the vote?
Mr. Chairman, 14 ayes, 0 nays.
All right, thank you. House Bill 1084 passes and moves on to government operations as amended.
Thank you, Mr. Chairman and committee.
All right, thank you. That brings us to item number 2, House Bill 106. And Representative Hale, you are recognized. I need a motion, a second. You have a motion, a second. You are recognized. The bill is properly before us, and you have an amendment.
Yes, sir. Code is 4781.
Okay, drafting code 4781. Can I get a motion?
Motion.
You have a motion, a second. Okay, if there's no objection, and this rewrites the bill, let's go ahead and get that on the bill. All those in favor say aye.
Aye.
Opposed? Ayes have it. Back on the bill as amended. You are recognized.
Thank you, Mr. Chairman and committee. This legislation updates the list of eligible child care facilities that are exempt from DHS licensure. The previous statute was outdated, disorganized, leading to confusion for both consumers and providers. So this basically, to sum it up, is less government transparency. The amendment that was just added on clarifies that the homeschools are not included in this. I stand ready for question.
All right, thank you. Do we have any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 106. Will the clerk please open the vote? All those in favor of 106 moving on to government operations vote aye. All those opposed vote no. Has every member voted? Does any member wish to change their vote? Clerk, please take the vote.
Mr. Chairman, 16 ayes, 0 nays.
All right, thank you. House Bill 106 passes and moves on to government operations as amended.
Thank you, committee and chair.
Thank you. Item number 3, House Bill 717 has been, without objection, will be rolled 1 week. That brings us to item number 4, House Bill 363 by Representative Reeves. You are recognized. You have a motion, a second.
Thank you, Mr. Chair. This is a bill to designate November as Diabetes Awareness Month. This is a particular issue of concern to me. 1 in 7 adult Tennesseans have diabetes. That's over 800,000 people. Another 1 in 7 have been diagnosed with prediabetes, and 1 in 5 that actually have diabetes don't know it. And I was in that last category about 2 years ago and was able to survive that and am thriving now, thank goodness. But this is something that we need to draw awareness to, and that's what the bill does. And I appreciate your support. Stand ready for questions.
Thank you. Do we have any questions? All right. Representative Capley, you're recognized.
Thank you, Mr. Chairman. Sponsor, is this your first bill in front of this committee?
Unfortunately, it is. I wish it was my second or third.
Okay, all right. With that being said, Mr. Chairman, if we could roll this to the heel.
To the heel.
That'd
Is
be
there any
great.
objection? Without objection, to the heel. No. No. All right, that brings us up to item number 5, House Bill 1311. Motion is second. I think Chairman Kumar, are you carrying that?
Yes,
And is there
I don't see it.
no amendment? Okay, you're recognized.
Thank you. This is administrative bill, and the legislation is aimed at clearing up many statutory issues that were discovered by the department during retrospective rulemaking project. First of these is that currently licensing software requires signature of so many board members on the license itself, and that's expensive because that's how the vendor charges. And with the new software available, that item is deleted. Thirdly, it gives the licensing boards the authority to appoint 3-member panels that can handle certain matters rather than the whole board to meet. Number 4, it clarifies that licensees do not have to be the subject of an investigation for the department to request information from them. And also that the department cannot provide information to law enforcement without a court order. And lastly, this legislation cleans up several references in the statute in regards to the function of respiratory care and electrolysis. I would be pleased to answer any questions. Administration's available in case the questions get too complex.
All right. Chairman Clemens, you're recognized.
Thank you, Mr. Chair. I'd just like some explanation around these 3-person panels. I'm concerned about if they're able to be split up into panels of 3, about the department or the agency deciding which 3 individuals are going to hear these cases to try to get a intended outcome rather than a fair hearing for some folks. Can you elaborate on these 3-person
Yes,
panels?
I have qualified assistants
Yeah,
to
with-
explain the matter.
yeah, without objection, let's go out of session. And for the record, name and who you're with.
Thank you, Chairman. Holt Witt, Department of Health. And the way it's set up currently, there are some boards that have the authority to appoint their own panels. So the governing bodies themselves would appoint their hearing panels. This happens a lot with our Board of Medical Examiners, just so they can get people to trial more quickly and expedite the cases, so they're not waiting on a quorum to get before the committee.
Chairman Clemens, you're recognized.
And what would the quorum normally be?
It varies from board to board, and depending on how many members are appointed, if there are any vacancies. But let's say there are 9 members on BME, they would be able to appoint a 3-member hearing. They're currently allowed to appoint a 3-member hearing panel for contested cases.
Chairman Clemens.
Nothing further. Thank you.
Any further questions while we're out of session? All right, seeing none, we'll go back into session. Any further questions for the sponsor of the bill? All right, seeing none, will the clerk please open the vote? All those in favor of House Bill 1311 moving on to calendar rules, vote aye. All those opposed, vote no. As every member voted. Does any member wish to change their vote? Clerk, please take the vote.
Mr. Chairman, 15 ayes and 2 nays.
All right. Thank you, Clerk. House Bill 1311 passes and moves on to calendar and rules.
Thank you, Mr. Chairman and committee.
All right, thank you. That brings us to item number 6 on the calendar. Oh. Cheryl, you are recognized.
Thank you, Chairman. Hey, I know I'm out of order. We have Dr. Sibley with us today, and we would like to welcome her if she's with us today. Thank you for being here.
Oh, thank you. Out of order. So that brings us to item number 6, House Bill 702 by Chairman Leatherwood. You're recognized. You have a motion, a second. And I believe there's an amendment that rewrites the bill. Is that correct?
Yes, sir. Amendment 4511.
Okay, you have a motion and a second on Amendment 4511. If there's no objection, we'll go ahead and vote on that. All those in favor say aye.
Aye.
Opposed, ayes have it. We're on the bill as amended. You're recognized.
Thank you, Mr. Chairman, committee. This bill would just clarify that a collection station licensed in Tennessee, which is operated by the owner of a Tennessee licensed medical laboratory, doesn't require an additional license regardless of where the specimens are sent. And some specimens are sent out of state for certain tests. And this just clarifies that.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, we are ready to vote. Will the clerk please open the vote? All those in favor of House Bill 702, moving on to calendar rules as amended, vote aye. Those opposed, vote no. Has every member voted? Does any member wish to change their vote? The clerk, please take the vote.
Mr. Chairman, 18 ayes, 0 nays.
All right. House Bill 702 passes and moves on to calendar rules as amended. That brings us to item number 7, House Bill 1157 by Representative Lynn. You are recognized. I believe you need a motion. You have a motion, a second, and I believe there are 2 amendments. Okay. Amendment drafting code 4093, is that correct? Okay, I need a motion. You have a motion, a second. If there's no objection, let's go ahead and get that on the bill to discuss it. All those in favor say aye. Aye. Opposed? Ayes have it. Okay, we're on the bill as amended, and I believe there's an amendment to the amendment, drafting code 4383. Is that correct?
There is, yes, thank you.
All right, I need a motion. You have a motion and a second. Okay, without objection, we will be voting on amendment 4383. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. You're recognized. Oh, without objection, if this bill passes, make a motion that we roll these 2 bills or 2 amendments together.
Oh.
Now you're recognized.
Thank you, Mr. Chairman. That was a lot of work. This bill is called the Restore Trust in Public Health Messaging Act. And we passed amendment number 2 in subcommittee. Amendment number 3 is at the request of the Attorney General's office, and they just asked for some discretion, and so it changed the shalls to mays for the Attorney General's office. But what this bill does is public trust and public health messaging plummeted during COVID-19 pandemic, and a 2024 U.S. Congressional Committee took a deep dive on the Health and Human Services COVID-19 marketing campaign to try to figure out how the campaign led to a massive loss of public trust. And much of the distrust came from the statements made about the vaccines and the masks and the emergency use authorization products that turned out to lack scientific support because CDC was making certain statements that were not backed up by the FDA and what they had for the product labeling and what the product could do. So the committee came up with several recommendations to prevent this from ever happening again. And one of those recommendations is at the heart of this bill. And the recommendation states, the congressional recommendation stated, Health and Human Services and its agencies should abide by the FDA's product labeling guidelines, HHS HHS and its agencies should be barred from promoting information regarding an FDA-regulated product that does not reflect the FDA-approved product label. And that's at the heart of this bill. We all remember during COVID, oh my goodness, so many varying opinions, so much misinformation, disinformation, families even fighting and not welcome each other to their homes, and even that is still today. And honestly, if basically CDC passed information down to the states, and if they had stuck with the FDA's product labeling recommendations, much of that could have been avoided. So this bill will ensure that no matter what the federal agencies say, like CDC, our public health messaging will be based on the FDA-approved labeling, which reflects the science on the products. So every product comes with FDA labeling, approved labeling, and that's what the product does and can do. And we can't help what people might say on social media, unfortunately, but we can help what our state agencies put out and what they say about products and what those products can do. And that way, our state agencies will always be that source of truth on those products. Hopefully, we'll never see another emergency like we saw, but we might. And we do want to make sure that we don't see families split up again and terrible fear and things happen like that. And this will go a long way to help. So we included this in this bill to protect the state's ability to publicly discuss and even criticize. The state is even allowed to criticize FDA labeling. Open discussions will help protect citizens from undue influence of the manufacturer on labeling content, and will also allow discussion on any new or aftermarket studies or data that emerges. The bill also ensures that state funding and federal funding distributed by the state through grants is never used to promote or distribute messaging that conflicts with the FDA product labeling. The Department of Health worked with us on this bill, and they have told us that they're comfortable with the language. And I ask for your vote of yes on this bill. Thank you.
All right, thank you. And I believe we have some folks that are going to testify. So if we want to wait for our questions to have them come testify, is that correct?
Oh, I'm sorry.
Is that correct? Or did you?
We
do you-
can do that, or either
Are they-
or.
They
Either
signed
or.
up. Do you want them to testify or no?
If we have questions from the committee, I would love to have them come up and testify and
Okay.
just share their experience.
Okay, let's first, are there any questions from the committee?
Okay.
Chairman Kumar, you recognized.
Chairman Lynn, thank you. Thank you for bringing this up. Kindly help me. Am I reading it correctly? So only FDA recommended uses of the products are to be promoted or listed?
You're recognized.
Thank you very much. So this does only talk about products, and when the state is putting out messaging, yes, they should stick to what the product can do. Of course, they can always add opinion, and that's what this says, but the emphasis would be on what the product is approved to do. But it does make that allowance, Dr. Kumar, for discussion and of the products, and also allow for new discovery. But the primary message would be on what the product is approved to do.
Chairman Kumar.
A common practice among physicians is what we call off-label use. So we will use a medication that is well-known and safe and proven for other uses, but then again, we also know, and it is in the journals, in the textbooks, and so on, that it can also be used for uses that have not been fully approved. A lot of times it's drugs that are low cost and generic, and nobody has taken the trouble to do the studies and submit to FDA. So does this interfere with off-label use by physicians?
No, this does not apply to physicians at all. It's only for our state health agencies.
You're
This-
recognized.
But what about state health departments? They would use those medications also for off-label use.
And they can use those medications for off-label use. What we're talking about is the promotion that we saw in the past, saying things that really were not proven about the product and were not true. And it created a lot of people saying, that's not true. It doesn't say that. Oh, yes, it must be, all of that. And so much confusion going back and forth. It's about messaging by the state. We wish the CDC would stick to that messaging too. It's really the CDC that created much of the trouble, but the state will then be a second screen to make sure that what they're saying really does stick to what the FDA has proven the product can do.
Well, thank you. Thank you, Mr. Chairman.
All right, thank you. Other, Representative Mitchell.
Thank you, Mr. Chairman. Question on the bill.
Question has been called. Seeing no objection, we are ready to vote. Will the clerk please open the vote? All those in favor of House Bill 1157, moving on to calendar rules as amended, vote aye. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? All right, clerk, please take the vote.
Mr. Chairman, 11 ayes, 6 nays, and 2 present not voting.
House Bill 1156 passes and moves on, 1157 passes and moves on to calendar and rules. All right. That brings us back to item number 4. House Bill 363. Can I get a motion? And a second? Okay. You are recognized again, sir.
I stand ready for questions.
All right. Is there any questions? Question has been called. There is no objection. Clerk, we are ready to vote. If you can please open the vote. All those in favor of House Bill 363, moving on to calendar and rules, vote aye. All those opposed, vote no. All right. Is every member voted? Is any member wish to change their vote? Clerk, can you please take the vote?
Mr. Chairman, 18 ayes, 0 nays.
All right, thank you. House Bill 363 passes and congratulations, moves on to, hey, we're not done with you yet. House Bill 363 passes and moves on to calendar rules. Thank you.
Thank you very much.
There you go. Thank you. Thank you. All right, seeing no further business before us, we are adjourned.